The first signs of urinary incontinence are dribbling or leakage of urine, in which the need to urinate may or may not be felt. A particularly difficult situation develops in a number of patients. A strong urge to urinate, which is practically not felt in advance, and which cannot be restrained even in order to reach the toilet. Urinary incontinence happens. Imperative. Uncontrolled urination of medium or large volumes, which occurs immediately after an acute imperative urge to urinate. Acute incontinence is the most common pathology among the elderly, but it also sometimes occurs in younger people. Most often, such a problem is provoked by taking diuretics. It also develops in women after menopause on the background of atrophic vaginitis, which leads to thinning and irritation of the mucous membrane of the urethra. Under stress, leakage of urine occurs due to a sharp increase in intra-abdominal pressure due to laughing, coughing, sneezing, weightlifting, etc. At the same time, the volume of urine varies from a small to an average amount. In women, this type of pathology develops as a complication after childbirth, and in men, after prostate surgery. Acutely, this type of disease occurs in overweight patients, due to increased pressure of internal organs on the bladder. Incontinence due to an overfilled bladder. Urine dripping. The volume of urine in this state is small, but the leakage can be constant and leads to a large amount of urine loss. This type of incontinence is the second most common in men. Functional incontinence. Involuntary urination due to physical or cognitive impairment, for example, after a stroke or Alzheimer's disease, as well as external factors that affect the urination process. Mixed, it is a combination of any of the types of diseases listed above. Causes of temporary urinary incontinence. Delirium of any etiology, infection, atrophy of the mucous membrane, taking medicines, mental disorders, polyuria, pathological compaction of stools, limited motor activity. Reasons for constant incontinence: functional insufficiency of the bladder outlet obstruction, hyperactivity of the muscular membrane of the bladder. Hypoactivity of the muscular membrane of the bladder, loss of coordination of the muscular membrane of the urinary bladder and sphincter of the urinary canal. Functional disorders, cognitive. Physical. Treatment of urinary incontinence is prescribed depending on the type of pathology and the presence of concomitant disorders. Prevention of urinary incontinence involves a careful attitude to one's own health and a set of recommendations: absence of excessive physical exertion and weightlifting. Timely contact to the doctor if there is a problem. Proper treatment of infectious and inflammatory processes. Weight control. Excess weight makes it difficult to control urination. Proper nutrition. Physical activity, strengthening of pelvic muscles, timely treatment of constipation, restrictions on coffee and alcohol intake. In addition to the recommendations listed above, Kegel exercises will help women avoid urinary incontinence after childbirth. Here you can add wearing a special bandage in the last stages of pregnancy to reduce the load on the muscles.